Hello, and welcome to The Answered Patient. I'm Jane Hansen. Every year, more than 700,000 people in the United States have a stroke. Strokes are the third leading cause of death in adults and the #1 cause of long-term disability. In this episode of The Answered Patient, we'll discuss the risk factors for strokes, the symptoms to look out for, and the latest treatments available. We'll also tell you the steps you can take to help prevent a stroke from occurring. Strokes can happen to anyone at any time. They sometimes begin with a sudden and powerful headache that can feel like a thunderclap.
My head really hurt. It was hurting. I never had a headache so bad. It's like it just wouldn't stop. It was just pounding. Right here, it was just pounding, pounding, pounding.
The symptoms can be large or small: blurred vision, loss of coordination, trouble speaking, or numbness on one side of the body.
If you or somebody you're with is having those symptoms, sit them down or lay them down so they don't hurt themselves. Don't give them any medications or food by mouth. Just pick up the phone, call 911, get them to the hospital as soon as possible.
Prompt treatment can limit the extent of brain damage and possibly mean the difference between life and death.
The mantra of stroke has been time is brain, and that just refers to the fact that we really want to emphasize that time matters.
Every minute of delay between the onset of symptoms and medical therapy leads to further brain damage.
Strokes occur when the brain is suddenly deprived of blood, oxygen, and nutrients. There are two types of strokes: ischemic and hemorrhagic. An ischemic stroke occurs when an artery in the brain becomes blocked, cutting off the blood supply. When blood flow is blocked only temporarily, this is known as a transient ischemic attack, or TIA. Though these are referred to as mini-strokes, TIA shouldn't be taken lightly. They may be a warning that a full-blown stroke is on its way.
Well, I was busy making soup and at my daughter's, and I suddenly began to feel across my face this tinkling, and it didn't go away.
The symptoms are basically identical to the symptoms of a stroke, but they typically last only a few minutes or a few hours, and the patient clinically makes a full recovery, meaning they don't have any symptoms left over. The importance of a TIA is that a TIA can oftentimes herald that a stroke is about to come in the next few hours or days.
The second type of stroke is a hemorrhagic stroke. This occurs when a weakened artery in the brain suddenly ruptures, flooding the surrounding brain tissue. Regardless of the type of stroke, the results can be devastating.
After a stroke, about half the people cannot walk normally. After the stroke, about a fifth to a quarter of folks cannot talk normally. A third of them may have significant depression, and a quarter to a third may end up in a nursing home.
Despite what you may assume, strokes can happen to anyone, whether you're 6 or 60.
The myth is that only old people get strokes, and that's just not true. It spans the complete lifespan of human beings. So we really want to get the message out to anyone that it could happen to you, and we really want to make them aware of it so that if something does happen, we can act quickly.
The most important thing people need to know about strokes is that 80% are preventable. The first step toward avoiding a stroke is to identify your risk factors and get them under control.
There are certain conditions that predispose people to having strokes. The usual high blood pressure, high cholesterol, and diabetes are very high risk factors for people to have strokes. No dizziness or lightheadedness.
We really want those individuals to start getting treatments early, because those conditions over time is what leads to stroke. And we're left with treating people at the end, after they've had their stroke and all those years have gone by that they could have done something.
There are also certain lifestyle choices that can help reduce the chances of suffering a stroke.
Diet and exercise are extremely important for preventing the risk of stroke as well as heart attacks. We know that good diet and good exercise reduce other risk factors like hypertension, diabetes, and high cholesterol.
When a stroke does occur, a variety of treatment options is available. These include clot-busting drugs, minimally invasive procedures, and emergency surgery. The key is seeking help immediately before too many brain cells are lost. Stroke victims who receive prompt treatment have the best chance of recovery. While a stroke can be a frightening and dangerous condition, having the right information can go a long way toward prevention and survival. In the other chapters of this episode, you can learn more about the symptoms of strokes, how strokes affect the body, and the treatment strategies that doctors recommend most. And in our personal stories chapter, you'll meet real patients who have survived a stroke and the family members and doctors who are helping them recover. Finally, if you'd like to be kept up to date on stroke prevention and treatment, you can subscribe to this series on our health channel at AnswersTV.com.